Hello, Facebook. We are thrilled to have you joining us. My name is Jocelyn Foy, and I am the Executive Director to the Woman Project, a grassroots feminist organization focusing on, at the moment, access to abortion in Rhode Island. I am majorly honored to be joined by three subject matter experts here. We first are joined by Dr. Ogochukwu Oneakwa, and bill sponsors Rep. Leanna Cassar and Senator Bridget Valverde. So today we do come together as the Supreme Court debates Roe, and people in Texas and in Mississippi and across the country watch abortion access slowly being taken away, especially for people who already face health disparities. We here in Rhode Island are taking on and interested in learning more and teaching more about the Equality and Abortion Coverage Act and why it is so important. This bill was introduced in 2020 with a robust and renewed push this session. We call it the EACA, is simply removing abortion bans to make the real promise to protect the right to abortion by getting rid of the discriminatory limits on health benefits in public health programs. So we intend to give you a range of ways to help by the end of this and get people activated at home, acknowledging COVID is a real issue. Thank you for figuring out a way to meet us here rather than in person, which we hope to do real soon. So real briefly, who is the Woman Project? What is the Woman Project? We, again, as I said, are a grassroots org that we're almost 5 years old. We are an all volunteer run group. We are honored to have Oge joining us, which is so exciting as a new board member. And we are going to be focusing this year on the Abortion Coverage Act. And so we're ultimately going to be activating people where they are at and finding different ways to engage, this one being meeting you at your home and on your computer or your screen. So we took on the activism around, and this is a little historical piece, the Reproductive Privacy Act, and got that passed with a range of activists and organizations and legislators in 2019. And when the Reproductive Privacy Act was passed, it included the removal of limits on private coverage for abortion that had been unenforced but remained on the books here in Rhode Island. However, that same kind of denial of health benefits for abortion is continuing for state employees currently, as well as people who use Medicaid. This is an unfair and targeted attack on people's ability to get an abortion simply because of the type of insurance they have. So this is where the Equality and Abortion Act was created. And I'm honored to have the bill sponsors here to talk a bit about that and where we go from here. And more than ever, we just all need to come together and do what we can to step up to truly protect the right to abortion for all Rhode Islanders, not just some who can afford it. We don't want to live in a state where the money in your bank account determines if we can get health care or not. So I'm going to pass this on to Dr. Oge, and we will take it from there.
Thanks so much, Jocelyn. My name is Oge Oneakwa. I am a OBGYN, and I'm an abortion care provider. And as such, this work and this act is instrumental to the work that I do every single day. And abortion care is healthcare, and that is not something that we can mince words about, especially in my field, because I do this every day. Repealing, just talking about the EACA, we should all be able to access the healthcare we need, regardless of where we get our insurance and how much money we make. And I see that the important and the impacts that denying health benefits has on our patients when patients are choosing between paying rent or going to get groceries due to a health service that they may need to pay out of pocket. It's not only incredibly harmful on the individual level, it has longstanding impacts on efforts to advance health equity and ensure the financial stability of our communities. And most of all, it's just wrong. The fact that some private insurance can afford them certain privileges, and others who utilize government insurance or Medicaid are unable to afford those same privileges. It's just not based on the tenets that our country was founded on. We must take action to close these gaps in care and make sure that whether someone needs an abortion or is endeavoring to add to their families and have a healthy pregnancy, that they can afford services and are provided support and compassion and not judgment, and certainly not more barriers. Repealing these restrictions will not by itself ensure full equality and equity for poor women and people of color, but doing so is a necessary precondition. Anyone who cares about fighting racism and poverty must realize that attacks on abortion, and especially on abortion coverage, are first and foremost attacks on poor women and women of color. So in short, root causes of inequality that drive health disparities amongst women, they differentially attack women of color and poor women, especially young women, who are the primary groups of women that tend to seek abortion care based on the data. And this differential access to treatment lowers levels of respect and competency from healthcare providers, the lack of trust in the medical establishment, the lack of accurate information, and a host of other socioeconomic factors leads to poorer outcomes, not just in relation to abortion care, but along medical lines in general. We need to make sure that we're choosing lawmakers who will craft policies based on science and aimed to improve health needs and outcomes, and not just advance a certain political agenda. And therefore, we really need to pass the EACA.
Oh, you're muted, Jocelyn.
Muted. Okay, there we go. Good. We had our first Zoom snafu. We're going to now pass it on to Rep. Kassar.
Thanks so much, Jocelyn, and thank you, Dr. Oge, for your words. You are so right, absolutely. 2022 really is the year that we need to pass the Equality and Abortion Coverage Act. We just need to do this to assure that all Rhode Islanders have equal access to abortion, which really is essential to everyone's social and economic stability, to their reproductive autonomy, and the right to determine their own lives. This legislation, first and foremost, is about equity. We all assume that where there's fair treatment under the law. We all know that something isn't a real right if only certain people can access it. And right now, our laws don't treat the individuals on Medicaid and the individuals on our state health insurance plans equally to others when it comes to access to abortion. I came to the legislature to bring my background in public health and health systems to bear on policy making. And in 2019, my first year in office, I had the honor of voting for the Reproductive Privacy Act. The RPA codified the right to abortion into state law. It was urgent in 2019 to codify Roe because we could see clearly that there was a risk of the Supreme Court turning back the clock and removing access to abortion that's been a right since 1973. On December 1st of this past year, the Supreme Court heard arguments in the Dobbs v. Jackson case, which would permit states to dramatically limit abortion access to the point where it would become nearly unavailable. Everyone who followed the proceedings that day drew the same conclusions. We're facing a Supreme Court that won't provide a guarantee at the federal level to respect and protect the rights of individuals to determine their futures, their families, and their health. We are at risk of the court overturning the precedent of Roe v. Wade. So it's up to each state to assure that abortion is legal and accessible. Abortion is healthcare, and access to healthcare is always determined by insurance coverage and the ability to pay for services. That's just the truth. We know that as we live through a pandemic, we know for sure that that's exactly what's happening. Rhode Islanders whose insurance coverage is Medicaid don't have insurance coverage for abortion. Rhode Islanders whose insurance coverage is through state insurance plans don't have coverage for abortion. The people who are impacted by the Medicaid abortion ban, about 77,000 Rhode Islanders, include many of our lowest wage earners in our state who are disproportionately people of color and include individuals with disabilities. The individuals who are impacted by the state insurance plan abortion ban, which is about 33,000 Rhode Islanders, include government employees, health professionals, students, educators, public servants, and their family members. In 2022, if we don't pass the EACA, it will be even harder for these two groups of individuals to access healthcare that they might need. Our General Assembly took great steps in 2019 to protect the right to abortion. The work remains to assure that this is a real right, accessible to all, regardless of income and regardless of insurance coverage. All of us here this afternoon are going to encourage you to get engaged and get active and fight for abortion equity. Let's let the governor know that abortion coverage needs to be included in the state budget. and let your senators and representatives know that the EACA is a priority for you. Access to abortion needs to be a real right so that Rhode Islanders can make decisions about their own bodies, their own health, their own families, and their own future.
Thank you, Rep. Now let's take it, Senator Valverde. Sorry, I'm dealing with your spotlight. Go ahead.
Okay. Hi, everyone. I'm Bridget Valverde. I represent East Greenwich, North Kingstown, South Kingstown, and Narragansett in the Rhode Island Senate, and I'm so happy to be here with everyone today. So we've just this week started a new legislative session in Rhode Island, and as this new session gets underway, we simply cannot afford to miss the chance to create public policy that will improve the health and well-being of Rhode Islanders. And reproductive justice must be part of the plan. Passing the Equality and Abortion Coverage Act this year will end decades of discrimination against public servants, their families, and people served by Medicaid. It will ensure that when someone needs abortion care, it will be covered by their insurance. Abortion care can cost hundreds of dollars or more, and people should be able to get care in a timely fashion using their health coverage. They shouldn't have to forgo paying for other things, wait weeks as they cobble together the money to pay for the procedure, or go without care at all. These bans were put in place deliberately to discriminate against people that could be controlled. And we have to stop making it so hard on people. To that end, we have requested that Governor McKee make this important public policy a priority this year and include the elimination of these abortion bans in his budget proposal that will be revealed in the next couple of weeks. And Rep. Kassar and I look forward to working with his administration and our colleagues in the General Assembly to secure passage this year. And when we pass this bill, we will be in very good company. All of our surrounding states, including Massachusetts, Connecticut, Vermont, New York, all of their Medicaid programs cover abortion. And to my knowledge, they don't bar their state employees from using their insurance to cover abortion like we do. Rhode Island is a discriminatory outlier, and it has to end. When we passed the Reproductive Privacy Act in 2019, it was an incredible victory for reproductive rights in Rhode Island, and one that we now know was absolutely timely, but we fell short. We cannot call ourselves a pro-choice state if we leave people out, if we leave poor people out, if we leave people of color out, if we leave people with disabilities out. As Rep. Kassar mentioned earlier, the Supreme Court is poised to get rid of Roe v. Wade, and so many states are enacting various barriers and bans on abortion. But we can be a beacon of light for reproductive justice here in Rhode Island, a beacon of light in these dark times when access to abortion is falling further and further out of reach for so many. When we first introduced this bill in 2020, we had great support from the public and our colleagues. And in 2021, that support grew. Last year in the Senate, we had 21 out of 38 senators sign on to the bill. And this year, I expect more. A clear majority of my chamber. And I look forward to the weeks and months to come working to get this bill passed, because as Rep. Kassar said, 2022 is the year that we get rid of abortion bans in Rhode Island. Thanks.
Thank you so much, Senator. So in conclusion, let's see. Okay, so in conclusion, activists want to see our leaders step up, be bold, and truly meet the needs in our state this year. That includes closing the gaps in this full range of healthcare, including abortion. And I'm going to repeat what a number of these specialists have said. We need the governor to reflect the values of our state and the clear interests of voters by submitting a budget that does not include these harmful bans. We need elected officials who are called to do the business of the people they represent, to meet the needs of the people and to stop these political games and get rid of these bans on health coverage completely. People rose up in 2019 and will continue to rise up until our rights are truly protected. So join us. I'm going to have a little sign. Join us at bit.ly.help-pass the EACA to sign up for different ways that you can get involved. And like your representative said, please reach out to your local House rep or senator and tell them that this is an important thing to see have happen, and definitely reach out again to the governor. It's so important. So thank you for joining us. We look forward to speaking with you soon, and we hope you have a healthy day. Take care, everybody.
Thank you,
Thanks
everyone.
again, everybody.
Thanks,
Thank
everyone.
you.